for the characteristic of the urine.
She says she's no good with words, but I'm worse. But started out a joke of a romantic stuck to my tongue. Way down with words too over dramatic. Tonight it's a can't get much worse. Worse, no one should ever feel like I'm 2 quarters and a heart down, and I don't wanna forget how your voice sounds. These words are all I have, so write them. So you need them just to get by. Dance, dance, we're falling apart to have time. Dance, dance, these are the lives you love to lead. Dance, this is the way they love. If they knew how misery loved me. You always fold just before you found out. Drink up, it's last call, last resort, but only the first mistake. I'm 2 quarters and a heart down, and I don't wanna forget how your voice sounds. These words are all I have, so write them. So you need them just to get by. Won't you show me little bit of spark you've been saving for his mattress? Dance, dance, we're falling apart to have time. Dance, dance, these are the lives you love to lead. Dance, this is the way they love. If they knew how misery loved me. Why don't you show me a little bit of spark you've been saving for his mattress? I only want sympathy in the form of you crawling into bed with me.
You were in college working part-time, waiting tables. Left a small town, never looked back. I was a flight risk with the fear of falling, wondering why we bother with love if it never lasts. I say, can you believe it? As we're lying on the couch, the moment I could see it, yes, yes, I can see it now. Do you remember we were sitting there by the water? You put your arm around me for the first time. You made a rebel of a careless man's careful daughter. You are the best thing that's ever been mine. Flash forward and we're taking on the world together. And there's a drawer of my things at your place. You learn my secrets and you figure out why I'm guarded. You say we'll never make my parents' mistakes. But we got bills to pay. We got nothing figured out. When it was hard to take, yes, yes, this is what I thought about. Do you remember we were sitting there by the water? You put your arm around me for the first time. You made a rebel of
I woke up, it was 7. I waited till 11 just to figure out that no one would call. I think I've got a lot of friends, but I don't hear from them. What's another night all alone when you're spending every day on your own? And here it goes. I'm just a kid and life is a nightmare. I'm just a kid, I know that it's not fair. Nobody cares 'cause I'm alone and the world is having more fun than me tonight. And maybe when the night is dead, I'll crawl into my bed. I'm staring at these four walls again. I'll try to think about the last time I had a good time. Everyone's got somewhere to go, and they're gonna leave me here on my own. And here it goes. I'm just a kid and life is a nightmare. I'm just a kid, I know that it's not fair. Nobody cares 'cause I'm alone and the world is having more fun than me. What the hell is wrong with me? Don't fit in with anybody. How did this happen to me? Wide awake, I'm bored and I can't fall asleep. And every night is the worst night ever. I'm just a kid. I'm just a kid. I'm just a kid. Yeah, I'm just a kid. Yeah, I'm just a kid. I'm just a kid and life is a nightmare. I'm just a kid, I know that it's not fair. Nobody cares 'cause I'm alone and the world is. Nobody wants to be alone in the world. I'm just a kid and life is a nightmare. I'm just a kid, I know that it's not fair. Nobody cares 'cause I'm alone and the world is. Nobody wants to be alone in the world. Nobody cares 'cause I'm alone and the world is having more fun than me tonight. I'm all alone tonight.
Welcome, welcome, welcome. Welcome to our 50th annual game of Who Wants to Be a Urinalysis? I will be proudly hosting our game show today. So, after searching throughout the nation, now we have come to our very last one standing couple that will fight in becoming the top urinalysis in our country. Now, I would like to welcome our today contestants, Mr. Fair Camels and Mrs. Camellia from Business of Camelicious. Please welcome. Thank you. So, first of all, let me give a brief explanation on our games today. For this level of grand finale, there are only 7 simple questions to be answered. You also will be given only 2 lifelines to help you in answering your questions. So, first of all, the 2 lifelines available are Who's the Audience, which you can ask any from our audience to help you in answering your question. And then another lifeline provided is a V calling, which you can ask the questions to other members of relative, even friend, who does not present in our site right now. I understand the rules and regulations? Okay, so shall we get started now? Let's start our switching in becoming Who Wants to Be a Urinalysis? So, let's move on to our first questions. Okay, our first questions for today is, what is acidosis? And there are 5 answers there. A, result when blood pH exceeds 7.45. B, is always corrected by chemical buffer system. C, is only caused by abnormal respiratory condition. D, may reflect metabolic production of acid. E, is compensated for intestinal secretion of hydrogen atoms. Okay, Miss Camelia or Mr. Farrah Camel, what can you understand about acidosis?
From what I know, acidosis is the increase of acidity in blood and body tissue. It also decrease of the pH level in that particular person.
So, what is your final answer for our first questions?
So based on the explanation from Kamal, I decided to choose D
Okay,
for my answer.
let's see, is this your final answer?
Yep, sir.
Okay, let me check it out. Correct, D is the answer, which is may reflect metabolic production of acid. Congratulations. So, let's move on to the next questions. The question number 2, acidosis result in increasing level of what ion? A, hydrogen. B, phosphorus. C, sodium. D, chloride. And E, calcium. So,
I think the answer is A, hydrogen.
are you really sure? How about phosphorus?
No, I think it is related to hydrogen, not phosphorus. A.
Okay, this is your final answer.
Yes.
So let's check it out. Congratulations. The answer is A, hydrogen. Well done for answering 2 right questions consecutively. However, the next question might be tougher than the first and the second one. Okay, let's go to the third questions. The third questions, a patient with alkalosis has experienced A, increased sodium retention. B, increased acid secretion at kidney. C, higher blood pressure. D, hypoventilations. And E, hyperventilations.
Okay, from my knowledge, the patient with cirrhosis will experience the hypoventilation. So, for the patient with alkalosis, will experience hyperventilation. So the answer, Kamal?
So your final answer is?
Our final answer is hyperventilation.
So let's check it out, whether the question is right or wrong. Congratulations, the answer is E, hyperventilations. Okay, now we are moving to the fourth questions, which is the pH level of arterial blood during alkalosis condition is A, over 7.45, B, below 7.35, C, over 7.35, and D, below 7.
735. I can see. I see. Sir,
Yes.
I think the answer for question 4 is C.
Is it your final answer, C?
7.35.
Okay, Miss,
Right.
you are like having any answer?
Okay, no. I don't think that is the answer.
So, since you are having two lifelines, so why don't you use any of the lifelines even? Are you sure you're not using it?
Yeah, I think we would like to use the who's the audience.
Correct choice. Now we are choosing for who's the audience. Okay, now the camera will choose who will be the luckiest to help our contestant today. Be waiting for the luckiest audience. Now the audience was chosen. Okay, what's your name, miss?
My name is Macrolina.
So, where did you come from?
I come from Macrolicious.
So, are you willing to help our contestant today?
I will try, but we will see.
Okay, so go on.
Okay, for this question, I will choose A over 7.5, 7.45. Because as we know, our normal blood pH is between 7.35 to 7.45. When it drops below 7.35, it will produce alcoholysis. And when pH is over than 7.45, it will produce alcoholysis.
So, what is your final answer?
I conversely choose A is over 7.45.
So, based on the audience answer, did you agree with the audience?
Yes, it's my answer. A.
Okay. Right.
So, once again, I would like to ask you, what is your final answer for the number 4 questions?
So we decided to choose A.
A is your final answer.
Yeah.
So let's see, is it true or no? Congratulations for answering the right answer, which is A over 7.45. Move on to the next questions. The question number 5, acidosis causes the, while alkalosis causes the A. Overexcitability of CNS, depression of peripheral nervous. B. Depression of peripheral nervous, overexcitability in CNS. C. Depression of CNS, overexcitability in CNS and peripheral nervous. And D. Overexcitability in CNS and peripheral nervous, depression nervous. So, what is your answer?
We think we would like to use the second lifeline. To use the V call.
So, you have decided to use your second lifeline, right?
Yeah.
So, let's use the V calling.
Camera on! Camera on! On!
Hi! Okay guys, actually we are now in the game show. So I hope you can lend your hand to help us to answer this question for this game show.
Alright.
So the question is, acidosis causes the, while alkalosis causes the, what you call it?
Blank space.
Blank space. So the answer we have A, B, C, D. And A, overexcitability of CNS, depression of peripheral nervous. B, Kama.
B. Depression of peripheral nervous, overexcitability in CNS. C. Depression of CNS, overexcitability in CNS and peripheral nervous. D. Overexcitability in CNS and peripheral nervous. depression, nervous. So that's the choices.
So what do you think, guys?
Oh, good question. Good question. Alhamdulillah. A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Masya Allah, I forget the question. Can you repeat? Anta, it's about acidosis, alkalosis, alcidosis,
No.
Oh.
Not alcidiosis.
No.
Acidosis.
Acidosis. And I remember, acidosis of acidemia is a condition where the pH is below 7.35. No, Masya Allah. The severe acidosis may cause die. Masya Allah. Innalillah. But alcoholysis, I forget. Anta, Ustaz Najee told us yesterday. Alkalosis is a condition where the pH is above 7.45. It may cause death. Masya Allah, Masya Allah, muscle spasms and convulsion. Astaghfirullahalazim, it may cause death. Nervous nerve also.
So what the effect?
The effect of acidosis may cause depression of CNS through the depression of synapse. But alkalosis? Anta, forget again, Anta. It will cause overexcitability, insanity, and people nervous. See, the answer. See.
Nervous?
See.
That's an answer. Right. Thank you, guys.
No problem.
Bye.
Bye. Assalamualaikum.
So, what is your final answer?
Come on.
Our final answer should be
Game show
C.
today. So let's move on to our finale questions. So our finale questions for today is: if a person has altered blood pH due to metabolic causes, hyperventilation or hypoventilation can help bring blood pH back to normal range, which is the A. Positive feedback regulation, B. Respiratory compensate, C. REM compensate, and D. Renal and respiratory compensate.
No.
What happened to your friend? I don't know. Oh, bring her to the doctor. Doctor, what happened to my friend? Oh, wait, I'll check her first.
Oh, her breathing is too slow. I think there's too much CO2 trapped in her body, and this is one of the symptoms of acidosis.
Acidosis.
Yes, acidosis.
Doctor, can you please explain to me more about acidosis?
Well, it goes like this.
Negative feedback regulation of blood pH by the respiratory system. Some stimulus disrupts homeostasis by decreasing the blood pH, or in other words, increases the hydrogen ion concentration. This disruption triggers the receptors, central chemoreceptors in medulla oblongata and peripheral chemoreceptors in aortic and carotid bodies. These receptors then send input or nerve impulses to the control center, which is the inspiratory area in medulla oblongata. The control center then gives output or nerve impulses to the effector, which is the diaphragm. The diaphragm contracts more forcefully and frequently, so more carbon dioxide is exhaled. As less carbonic acid forms and fewer hydrogen ions are present, blood pH increases, or in other words, hydrogen ion concentration decreases. This response brings blood pH or hydrogen ion concentration back to normal.
So, what is your final answer for these final questions?
C.
Are you really sure?
Yes, C. Renal compensation.
Because this will change your face in the future. Are you really sure?
Yes. I am really sure. C. Renal compensation.
Okay, C has been sealed. So, let's check it out whether the answer is right or wrong. Congratulations! The answer is C, renal compensate.
Come on.
Congratulations to both our winner today, Mr. Ferry Camel and Miss Camelia from District 9 Camelicious. Now, I would like to announce the winner of Who Wants to Be a Urinalysis are Mr. Ferry Camel and Miss Camelia.
Hello. Do you know water is important in our living cell? As a solvent, as a transport medium, as a part of metabolic reaction. Water takes up about 50% to 70% of our body weight. For your information, the increase of our amount of fat in our body will reduce the percentage of water in our body because the fat will hold less amount of water instead of the muscle cell. The maintenance of proper fluid balance involves the pH and buffer, tonicity of solutions, the forces of capillary exchange. So, for a normal everyday, we will lose our water through breath, perspiration, urine, and movement. So, for a normal, healthy adult, adequate intake of water is for men is about 3 liters and for women about 2.2 liters. I'm feeling so thirsty. Thank you. What is this? Salt water?
Do you know, if high salt intake, our body fluid balancing will be disrupted. As the body drinks the salted water, the first concentration of the NaCl, which is much lower than the H2O concentration, will increase after the drinking of the salted water. So the concentration of the NaCl after the drinking of the salted water will much higher than the H2O concentration.
Osmosis will happen. The water will move from intracellular to interstitial and then to the plasma. The water will move from high concentration to lower concentration.
Consequently, the water from the blood vessel will enter the blood cell and causing the blood volume to be increased.
Hi, that's right. The arterial natriuretic peptide will release into the blood vessels in response to the stretching of the arterial heart. Oops. Locked up. The arterial is stretching. This is because the blood volume is increased.
Let's continue to our next process. The initial blood volume increases also slow the release of renin from the juxtaglomerular cells. As the level of renin declines, the less angiotensin II is formed.
Okay guys, maybe you're curious about the next process. Okay, the next process is glomerular filtrate will increase. The filtrate substance include the water and all solute present in blood, including ions, glucose, amino acids, and creatine, except proteins. Okay, next, aldosterone production is low. This is a kidney, and this is adrenaline gland that produces aldosterone. As we know, aldosterone promoting urinary reabsorption of Na plus and Cl negative. When the aldosterone is low, this water reabsorption via osmosis also will low.
As the increasing of AMP, it will reduce the reabsorption of Na plus Cl negative by the kidneys. You can see the diagram here. And AMP promote natriuresis, which is natrium equal to sodium. This will increase the loss of Na plus and Cl negative in urine.
When NaCl loss increases in urine, the water loss also increases, which will result to dilute urine.
Finally, the blood volume will decrease. Yay!
In blood plasma, the composition of the sodium ion has the highest compared to the potassium, calcium, and chloride. While in the intracellular fluid, the potassium ion has the highest composition compared to the other ion. Whoa! In the interstitial fluid, the potassium ion also dominates the environment fluid of the body.
Now I see, I know, I understand.